All right. So, very good morning, everyone. So, this is a part of the lecture for the course of this veterinary diagnostic imaging. Uh, the main focus for today's session is reproductive ultrasonography, which is a lecture component of the practical session that we had last week. Okay. So basically, these are the main contents that we would like to address in this session. I will be discussing the overall diagnostic imaging techniques relevant to reproduction. We'll try to see also the different indications or applications that we have for ultrasonography in large animals. We'll have also a look at the procedure itself, the different types of machine that we have in the ultrasound, and also the positioning and also the approach for the application of the ultrasound in large animals. And on top of that, we'll try to see also the main differences that we have across the different species of animals in terms of the application of the ultrasound in reproduction. So as you may know, there are different diagnostic imaging techniques available for application in veterinary medicine and more specifically in the examination of the reproductive system. Among those important diagnostic imaging techniques that we have, radiography and ultrasonography comes in the first place. And these two different imaging techniques, they have got their own advantages and also disadvantages. So if you look at the radiography, basically this technique is mainly if it is required, it's going to be most commonly applied in small ruminants like sheep and goats. That is referring to the reproduction aspect. All right. And because of that, it is less commonly applied technique, less practical because of different reasons that we'll discuss later on. And in fact, one of the main reason why this imaging technique is not that in advantage compared to that of the ultrasonography is the risk of radiation to the person who is conducting the procedure, as well as to the animal, and also to the growing fetus, especially when we are talking about the use of radiography for a pregnant animal examination. And more specifically, when you are talking about the use of radiography in diagnosing pregnancy, you'll find this technique less relevant because it has to wait until development of the skeletal system of the fetus, which is going to be, which makes it difficult for us to use this technique to diagnose pregnancy at the early stage, because at the early stage we don't have the skeletal system or the bony structures of the fetus developed. So this is another disadvantage, what makes it this technique irrelevant. And when we come to the second important diagnostic imaging technique, which is of course the focus of our lecture today, is the ultrasonography. This is the most practical and commonly applied method when it comes to reproductive system examination. All right. And talking about the procedure, the principle behind ultrasonography, I have tried to mention or discuss this issue last week in our practical session. It entirely depends on sound waves, by producing sound waves. And for the production of these sound waves, you remember that there are different components, okay, of the ultrasound machine. And basically, one of the main components of this ultrasound machine is the transducer or the probe. So this ultrasound probe is the one which is in charge of producing the ultrasound waves. and it is able to produce these ultrasound waves because there are what we call these electrical crystals, piezoelectrical crystals within the probe. So these crystals, upon subjection to electric pulse, they tend to vibrate. So upon vibration, they produce the sound waves. So this sound wave, which is produced, will propagate into the object or into the tissue or organ which is intended to be scanned. So once the sound wave is emitted into the object, then they depend on the degree of density or the density of the tissue. Then there will be a reflection of the sound waves back to the transducer. All right. So as you can see here, the red lines refers to the original waves which are produced from the transducer, and they are propagated to the tissues or the organs. So after the sound waves reach to the organ, then they will be reflected back. So the broken green light shows you the reflected wave, which is going back from the object to the transducer. So as you can see here, the transducer is acting as the producing center, at the same time the receiver for the sound waves. All right. So these reflected sound waves, which are also known as the echoes, are received by the transducer, and then after that, that will be transformed, or it will be processed by the CPU in the computer machine of this ultrasound, and then will be converted to become an image, or to be displayed as image, as you can see here on the screen of the monitor of this ultrasound machine. So you'll be able to see a grayish whitish color of image, okay? And then you can interpret what you see on the screen accordingly. All right, so as far as the machine is concerned, yeah, I mean, and the components which comprises, this is an example of a diagrammatic presentation. So we have got the transducer, which is going to be in connection or in contact with the tissue or the object to be scanned, and then it is connected with a cable, and then back to the main central CPU, which is going to be connected, and there will be an electric supply source. All right. And then you have got the monitor where you'll be able to see the image displayed. All right. So these are the main components. So within the CPU part, you'll have the pulsar amplifier, which amplifies the reflected sound waves coming back from the transducer. All right. And before it is converted digitally in the form of image on the monitor. All right. So generally, you may classify the components as oscilloscope, which includes the monitor and the command keyboard. I'm sure you know this because you have seen it last week. And then the other component is the probe, the ultrasound probe, or we call it the transducer. And the rest is the accessories or the attachments, including the printer, your electrical source, the battery, and so forth. Okay. All right. So this is another simplified form of presentation for the different components of the ultrasound machine. The same thing, you have got the monitor, the keyboard, the command keyboard all together, which we refer to them as the oscilloscope. And the central processing unit, the CPU is there. And then we have the storage device. You can store the images that you see. And you have the printer all representing the accessories, all right? And the probe, which is the most important part or component of the ultrasound machine, as I said, which is responsible for the production of the sound waves and also for the receiving the reflected sound waves back from the object which is being scanned. All right, as far as the design is concerned, there are different designs of this ultrasound machine in the market. You may be able to see all these different varieties. These are some of the examples that we have in our lab. This is the oldest machine that we had in the lab, which is a Loka ultrasound machine from Japan. And this is a later, the other one, which is relatively latest one compared to this one, the Sui machine, which is at the moment I think it's not in order. And we have another one, the latest one from the Draminski. I think you have seen that during our practical session, which is of a very mobile type, very compact in design, and it can be easily carried into the field, and which is very practical. So we have so many different designs, but the basic function and the way it's operated is more or less similar. Okay. Now looking at the components in detail and the various types of each of these components that we have, basically referring to the transducer. So when we talk about transducer, as I say, this is the part of the ultrasound machine which is important for the production of the sound waves and to receive the reflected sound waves or the echo back from the object. And when you look at these probes or the transducers, they are of different types. And the major classes of these probes are two. One is a linear probe, the linear array probe, and the other one is a sector array probe. So the linear array probe is the one with the linear flat surface, or, if you remember, as I showed you before, in this example, you can see the second one from the right, the second picture with the linear. So the surface is linear, I mean flat. And it's linear because the arrangement of the crystals, as that I mentioned, which are vibrating to produce the sound waves, are also arranged in a straight line manner. So that's why it's a linear array type of probe. Okay, and these linear probes, they may have entirely with the flexible cord for connection with the CPU, the one that I showed you last week, which is commonly applied for rectal examination in large animals. And some of these linear probes also, they come with a special design having handle. It's a fixed handle. And this is basically for the small ruminants for transrectal examination to be operated or to be done from outside of the rectum. So I hope you remember this also, which I showed you last week. The other type, the sector array probe, and which is also known as the convex type of probe. So this, as the name itself implies, the arrangement or the shape of the probe is which in a convex manner, is a convex shape of the probe. So you can see here from the left side, the first probe, you can see how the surface looks like, which is a curved one, which is a convex type of probe. Sometimes also they refer it to as curved one, but I think convex or sector array probe is the most preferable terminology to be used. Okay, so this convex type of probe, it can have also a smaller size, which is referred to be the microconvex, and you can have also a little bigger, which is a macroconvex type of probe. And I think I have showed you these different variations or varieties of the probes last week from the lab. Okay, so as the name itself varies, the kind of image that is produced using these different types of probes will be also different. So for example, when you are using the linear probe with a flat surface, you can see the kind of image which is displayed on the monitor, is going to be a rectangular kind of image that you are going to produce, that is in the shape. And when you are using the sector probe, or if you are using the convex type of probe, the kind of image that you produce will be a truncated concept kind of image. You can see it's not rectangular, but this is a concept kind of appearance or shape, which it continues to expand or make the view of the ultrasound expanding downward as you go along or across the tissue or the organ that you are scanning. Okay. So the other thing is the modality, all right? So as far as the modality of the ultrasound is concerned, you have generally we have got 4 different types of modalities, which includes the A mode, which is the amplitude, and we have the B mode, which is a brightness modality, and we have the M mode, which is a motion modality, and the Doppler modality. So among these 4 different types of modalities, the most commonly applied modality is the B mode, which is a brightness modality, which gives us a grayish white kind of appearance of the tissues depending on the degree of density or the sound reflection that we have from that given structure. All right. Sometimes you can have a combination of the brightness and then the motion modality. So you can have like a B plus M mode of modality. All right. So moving on, the indications. All right. So we know the basic principle behind. We know the various components of the ultrasound machine itself, the different types of probes, and the modalities. So once after you know all these, basically the main purpose is to use or to make use of this device for the benefit of for the benefit of the diagnosing problems, or examining structures to come up with a certain diagnosis and treatment approach. So now we'll see what are the indications or the various types of applications where we can be able to use this ultrasound machine pertaining reproduction. In this case, our focus is reproduction, but generally, the application of the ultrasound is not just limited to the reproduction, but it can be also applied to various body systems. Of the cardiovascular or to the GIT, gastrointestinal system, so the visceral organs of the body. So it can be applied to the various organ systems in the body. But yes, our focus for this session is basically the reproductive system. So along the line of the reproductive system, we have got different indications or applications. So one of the main area of application is the female reproductive system. All right. So it enables us to monitor the female reproductive activities. And this one of the most commonly applied indication, or the most common indication in this area, is pregnancy diagnosis. All right. So this is the most routine application in our daily activities here in the unit. So the other thing is, apart from diagnosing pregnancy, ultrasound can be used to monitor the ovarian activity. Of course, during pregnancy diagnosis, especially when you are doing it transrectally, then you'll be able to examine the ovary too. But generally, ovary is not examined during pregnancy only, but it can be also examined out of pregnancy to diagnose any problems associated with the ovary, or to monitor the reproductive activity or the cycle of the animals. Okay, and apart from this physiological aspect of the reproductive system, the ultrasound also can be used, or it can be applied to diagnose reproductive disorders or reproductive diseases. Among these disorders include cystic ovarian disease, and you can be also use this diagnostic method for examination or diagnosing the endometritis, which is referring to the inflammation of the endometrium of the uterus. You can also use it for diagnosing pyometra, which refers to the accumulation of pus in the uterus. Mucometra, when you have fetal mummification, maceration of fetus, and all these congenital defects can be also diagnosed using this ultrasound machine. In addition to that, the ultrasound machine also can be used to monitor the, or in order to apply the assisted reproductive techniques. For example, OPU. OPU stands for ovum pickup. So sometimes in embryo transfer programs, you might need to induce animals to superovulate. And after you induce superovulation, you may want to, before ovulation, you may want to harvest those pre-ovulatory oocytes from the ovary. So there is a specially designed ultrasound machine for the ovum pickup. You can go through transvaginally, and you can collect the oocytes from the ovary. So this is again another area of application, more advanced application in the area of reproduction. Okay. Not only females, males also benefit from the use of this ultrasound machine in reproduction. And one of the things is it can be also used to examine the testes. So clinically, you can assess the testicular condition using ultrasound. So you can assess the parenchyma of the testis, whether it is having a normal consistency or appearance, or it has got if it has got any lesion within the testes. You can use ultrasound for this purpose to find out. And in addition to that, in a transrectal examination, ultrasound also can help us to examine the condition of the accessory sex glands. And you know that we have different accessory sex glands within the pelvic region. They can be accessed through the rectum by using ultrasound. And you can use one of the common, most important accessory sex gland, for example, is the seminal vesicle or the vesicular gland, which is quite sensitive to infection. So during breeding soundness examination of the males for selection purpose for breeding, if you have got access to ultrasound, you can be able to use it to scan and examine the health condition of these glands. And of course, as part of this pelvic ultrasound examination, the other important urogenital organ is the urinary bladder. So urinary bladder is most commonly examined during our routine examination of the reproductive system because it is connected with the genital system. And oftentimes we also use the bladder as our point of reference during our examination. So it's very important to remember that we have got this urinary bladder in that region. At the same time, we need to also remember that we have got to differentiate between the uterus and the urinary bladder, because when the uterus gets pregnant or when it becomes gravid, there is some degree of similarity because there is some fluid contained in both cases, even though the nature of the fluid is different, but the appearance using ultrasound is the same. So you have got just a dark appearance in the bladder because of urine, and when you have a uterine fluid or amniotic fluid in the uterus, you will be able to see the same kind of appearance, which is going to be dark. So you're going to remember this, and we need to differentiate between these two organs. All right. Okay, this is a brief summary, I think, which is supposed to come immediately after the comparative presentation of the ultrasound and the radiography. But basically, this is a list of the advantages of the B-mode ultrasonography over the radiography in pregnancy diagnosis. So remember that we can also use radiography to diagnose pregnancy, especially like small ruminants like sheep and goats. It can be applied easily, but it comes with a lot of disadvantages when we compare it with the ultrasound. So what you see here in the list is various advantages of the ultrasound over the radiography. So the number one advantage is a real-time procedure. It is a real-time procedure, meaning that you can see the result immediately while you are scanning, and you can interpret the image and you can diagnose even the case. All right. So that is one of the main advantage for for radiography. As you may know, you have to process the image first before you get the result, and it has to be interpreted. And the second important advantage is also the procedure is non-invasive, so it doesn't cause any harm to the animal, and it is also safe to the personnel who is conducting the procedure, meaning that there is no radiation hazard, and also for the dam and also the developing fetus. That is unlike that of the radiography or the X-ray. And the other thing is portable. Most of the time, we can have portable radiography, but which is not really common, that common. But ultrasound is something which is very mobile. It can easily be carried and taken into the field. And you know that most of the time, especially when you are talking about large animals, the activity is in the field most of the time. So you have to carry the device to go to the field, and it has to be mobile. So that is one of the other main advantage. It's not that easy, the radiography to be carried to the field, especially those designs that we have in the hospital, like you see it for large animals. Okay. All right. So the other thing is the ultrasound also is very important to detect or to determine the viability of the fetus during pregnancy examination. And this is not possible using radiography because it gives you a static image. It doesn't give you a live, real-time examination. So because of that, you cannot be able to know whether the fetus that you are examining during the procedure is alive or dead. So the other advantage is it can be used to diagnose early stage pregnancy because ultrasound doesn't depend on the development of the skeletal or the bony system or the bone system of the fetal skeleton. So, but in the case of radiography, for you to be able to see uh, the the image clear, you need to wait until the fetus skeletal system is fully developed and ossified. So that is a disadvantage by itself for the radiography. But ultrasound, it doesn't require this criteria for it to be applied. Okay. So in this section, we will just briefly look at the different types of ultrasound probes and the frequency range, which is preferred to be used across the different species of animals. So basically here, the objective is for you to understand the differences among the different species of animals in terms of the application of the ultrasonography, the probe type and the approach and the frequency range, which is selected for each purpose. So here in the first row, you can see for the small ruminants, all right, small ruminants, we have got two different approaches. We'll see that in the next few slides. So we can be able to conduct through the rectum, which is a transrectal approach, or it can be done through the abdomen, which is a transabdominal approach. So for transrectal approach, the kind of probe that we need to choose is a linear probe. I hope you remember this. And the nature of the frequency range that we can choose is higher in this case because there is a close proximity between the organs to be scanned in the rectum and the probe itself. So there is a very close proximity between the ultrasound probe and with the organs to be scanned, like the ovary and the rest of the system. So because of that, you can increase or you can be able to use a higher frequency range, which provides you actually better resolution and quality or image. Okay, so the other type of probe that we have is, of course, a sector probe, and this is mainly chosen for the transabdominal approach. And when you are doing transabdominally in a small ruminant using the sector array or convex probes, then you have to choose a lower frequency because there is a longer depth of penetration required to reach to the reproductive system and be able to see the what's happening along the system. All right. So you have to combine a convex probe with a low frequency range of sound waves so that you can be able to access to the organs. For the bovine, that is for cows, basically the most common approach is transrectal. It doesn't mean that transabdominal cannot be never be applied. It can be applied, but it can be applied only very late stage of pregnancy or very advanced stage like 6, 7 and above months of pregnancy. So, but the most common approach is a transrectal approach. And for this approach, you use a linear array probe. And the frequency that you can use is a higher frequency range from 5 to 7.5. For equines, especially in mares, you can also you can have both approaches, transabdominal and transrectal. So for this transrectal approach, of course, as the same is true like the rest of the animals that mentioned above, you can go for higher frequency range, 5 to 7.5 megahertz. And for transabdominal, obviously, you have to go for a low range of frequency from 3.5 to 5 megahertz frequency. And you have to use a convex or sector array type of probe in this case. Here is just an extension from the previous slide, and it tells you the frequency of the probes in relation to the depth of penetration and image quality that you'll be able to see, all right? So here we have got three different frequencies, 3 megahertz, 5, and 7.5, which you commonly found in those ultrasound probes that we use in our labs or in our clinic. So the 3 megahertz frequency probe, usually it can penetrate a depth of 0 to 20 centimeter depth or field of depth. So meaning that this is the longest, the most deepest, length that you can go through across the tissues, all right, using this kind of frequency. If you increase the frequency, the depth is getting shallower and shallower, meaning it's becoming shorter and shorter. So for you, 5 megahertz, for example, you will be having an intermediate field depth, which is up to a maximum of 12 centimeter depth. And if you increase the frequency to 7.5, then the depth reduces to a maximum of 7 centimeter depth. So you have to consider this in mind when you are choosing a given frequency for a particular organ system to be scanned. All right, so you have to consider the anatomical location of that organ, how far it is located. All right, and then of course, when you are also playing around the frequency range, it also changes the nature of the image quality that you get, or the resolution of the image. So as you go from a low frequency range to higher frequency of the probes, then the resolution becomes much better. Meaning the lower the frequency range, the lower will be the resolution and the quality of the image that you will be able to obtain. But if you increase the frequency range to higher, then the resolution of the image gets better and better. So this is like an inverse relationship between the frequency range and the resolution. All right. So because of that, obviously the timeline for the stage of pregnancy during which you will be able to choose different types of frequency ranges will be variable. All right. So the lower frequency range will be utilized for advanced stage of pregnancy, because you want to see, because the fetus will grow up and the content will be so much, so you will need to have a bigger depth coverage. So if you want to go more deep, then you have to decrease the frequency of the probe. So 5 megahertz is the one which is commonly used in a transrectal approach, sometimes in transabdominal too. And for the sake of examining the smaller structures like ovary, and you want to see the details within the ovary, like the follicles, then in this case, you have to choose a much higher frequency range, like 7.5, for example. So this gives you smaller details within the ovary itself. And of course, early pregnancy also will benefit from a higher frequency range, and determining sex of the fetus, which is also conducted during early stages of the pregnancy period, also requires the use of this high frequency range for us to be able to see that details of the sex determining structures, especially like the gubernacula. All right, so this is a diagrammatic presentation to show you how the positioning look like, and also how the different approaches of the ultrasound use is in small ruminants is done. So from the left, you can see this is a transrectal ultrasound examination approach. All right, this is a transrectal approach. So in this case, you introduce or you insert the probe through the rectum from outside, and this probe must have a different design. You can see this is a handle. So before the flexible cord, there is a fixed handle which is used for handling or monitoring or manipulating the probe inside the rectum. The other approach is a transabdominal approach. So the location of the where you need to put the probe is in the inguinal region, lower abdominal region, somewhere around the cranial or the ventrolateral aspect of the belly, all right, near to the udder. So that is a location where you need to put the probe, and the probe has to be directed in a caudocranial manner. Dorsocranial. Sorry, this is a dorsocaudal, direction. Say the probe has to be from the ventral inguinal region. It has to be directed in a dorsocaudal approach. so that you can be able to cover the area where the reproductive system is located. So you can be able to see the organs, especially the urinary bladder here. As if you remember, this is one of our reference point because it's located nearby the reproductive system, and it's usually easy to locate the urinary bladder. So once you locate the bladder, then you know that you are around the reproductive systems, so you can easily assess the reproductive system as well. Okay. Okay, these are some practical examples, pictures that were taken during our practical sessions in the past. And this is one of the wild ruminant species, which is actually a deer. So it's not only for sheep and goat. When you are talking about small ruminants, any wildlife animal also can be used, or it can be applied to those kind of animals too. So this is a transrectal examination done by students during their practical session in a deer in TPU. Here is again another picture which is done by students also using this Aloca machine, with the old machine that we had. And this is a transabdominal approach. It's not very directly visible. It is from the other side. So you have to locate from the inguinal region of the ventral abdominal area near the udder. That is the location. Okay, so this is in cows, so large animals generally. So we have got the main approach is transrectal, all right? So it's a transrectal approach. So as you can see here, you can be able to conduct transrectally using a linear probe, okay? So the same is true, the organs that you expect to see in this examination procedure. The bladder is there, the urinary bladder, so don't forget that. And after the bladder you have got the body of the uterus and also the uterine horn. So anatomically it's very important for you to remember the structural components, so the components of the organ system in the reproductive tract. All right, and these are some of the examples, pictures that shows how the transrectal examination is conducted in large animals, especially in cattle. So this is how we do it in the field. All right, you have got the animal, you have to have a glove, and then you have the probe. You need to apply gel, and then you introduce into the rectum, and then you have to examine through the rectum step by step, starting from the bladder, then move on cranially to assess the uterine body, the horn, and the ovaries along the way. So you can see the image on the screen, and students can see also, and you can be able to learn what's going on inside the rectum. Okay, so basically in this approach, since you are doing it inside the rectum, if you have got an experience of doing rectal palpation, will make the whole process easier and will make it much friendly. I mean, the procedure will be much easier if you have got that prior experience of doing rectal palpation. So it's not only in cattle, large animals, it can be also used in other ruminants like in camel. So this is one of the example that we did some time ago. So you can also use transrectal examination in camel by using the linear probes for diagnosing pregnancy. All right. So this is just an example of an ultrasound image that you can see displayed on the screen. All right. So this is from a small ruminant. I think we take this image. So this indicates a uterus of advanced stage of pregnancy, all right, which is the result of transabdominal scanning. And you can see here there are different mixed kind of echogenicity on the screen. So you have got a hyperechogenic whitish appearance, and you have got also dark appearances around here. So those whitish, grayish white hyperechogenic spots along this way represents the vertebral column, the vertebral column. And along this line, you can see like a zebra cross of grayish white lines, right? And this represents the ribs of the rib cage or the thoracic cage. All right. And if it is a live image, if you see by the time you are doing the scanning, you would be able to see also the heart within the thoracic cage beating, right? So the heartbeat can be visualized within the thoracic cage, and that is an important advantage of ultrasound, as it enables you to determine whether the fetus is viable or not, all right? So this is just as an example of transabdominal uh, scanning in goats or in small ruminants. Okay, when the animal is not pregnant, we can still use the technique to examine and see the status of the reproductive physiology or the reproductive cycle. So here is a transrectal examination result of the using a linear probe, all right, of the uterine horn. So you can see here, all right, the appearance of the uterine horn, which is in a curved or curled manner. So you can see this is the end portion of the uterine horn, and it goes on like this, caudally, all right? So it is, I've got this kind of curled appearance, and this is the lumen at the center, and this is the thickness of the wall of the uterus, all right? Number one and number two, referring to the various layers of the muscle layer, which is number one is endometrium, and the number two is referring to the myometrium layer, all right? So, but here in the middle, you don't see any dark space because there's no content, so no fluid content. So we know that this is an non-pregnant situation of the uterus. All right. But what happens when the animal gets pregnant? Okay. When the animal is pregnant, obviously the previous appearance will change. All right. It changes from having a uniform echogenicity across the cross section or longitudinal transverse section of the uterus. It changes towards the having some mixed echogenicity, having a dark space surrounded by an hyperechogenic grayish white appearance. So as you can see here, this is a 27-day pregnancy of a cow examined transrectally using a linear probe. And as you can see here, the most prominent structure that you see is a dark space, a dark rounded space, which is representing the amniotic fluid. So fluid content of a given structure appears as dark in by using ultrasound. So this is one of the important things you need to remember when you want to interpret the image. And we refer to that as anechoic structure when it becomes dark and no echogenicity. So this is an anechoic dark space visible at day 27, but the embryonic proper is not really that visible, even though we refer to this as the embryonic vesicle. But as time goes on, at day 35 of gestation, you can see the area of amniotic fluid, which appears as a dark anechoic space, is getting bigger, and the embryo also becomes more visible, as you can see here. So this is a more hyperechogenic structure, and we refer to this as the embryo proper. So I think in the next semester we will learn about embryogenesis. So until day 42, it is an embryonic stage. It's not a fetal stage, right? Fetal stage comes after day 42 of pregnancy. So until then, we refer to it as embryo. So this is the embryonic proper that you see surrounded by the big area of amniotic fluid, which appears to be dark. Okay. Next is, again, this is a day 50 pregnancy. You can see a much bigger amniotic fluid, all right, which is dark anechoic space. And then, of course, the fetus is coming in now. Day 50, we can refer to it as fetus, okay? And this fetus appears to be hyper echogenic in most parts, all right? And then you can see also the different parts of the body of the fetus. Here, day 90, you can see quite mixed kind of echogenicity because there are different components of the fetus or structures of the uterus developing and becoming more visible. So one thing which is very new here is the placentomes. You can see on the top line here along the endometrium. So you have got this convex appearance, convex shape rounded structure, which is hyperechogenic entirely, appearing grayish white, and this is the placentomes. And in addition to that, you have the dark space, which is represented by the amniotic fluid. And of course, the fetal component itself, the bony parts of the fetus. You have got here the vertebral column, all right? And these are the thoracic ribs, or the rib cages, the area of ribs. So this is like the head region of the fetus. Okay, it's just for you to practice. Again, this is one of the image that we took during our practical sessions in the past. So it is for you to try to determine what each of these arrows represent. Okay, maybe if we get time, I'll see you back later for this image to interpret. Again, this is for you to practice to determine what those yellow arrows indicate, what is represented by this arrow, and this bounded portion. So I hope you try by yourself, and later, if we get time, we'll come back to it to try to interpret what it means. Okay, so this is another example of transrectal examination of the cow showing the ovary. It's not really very clear, but this is where the ovary appears. It has got some degree of mixed echogenicity because of the follicles. Those follicles are structures within the ovary containing some amount of fluid inside their structure. So that makes them to become less echogenic or anechoic appearance. So because of that, and the stroma of the ovary itself, it gives a mixed kind of echogenicity. Much more clear ovary with the problem is here. See, these are examples of ovarian cysts, which are personal collections by myself. So this is a polycystic ovary that was found in one of the cows, Brangus cow from TPU. And you can see a mulberry kind of appearance with a multiple follicular cystic appearance. And it has been there quite for a long time in the animal during our examination. And this is another follicular cyst, which was diagnosed or found from a KK or Kadacalantan cow. And this is again another type of follicular cyst. This is, as you can see, is a luteal cyst. So remember, one of the reproductive disorders that we can be able to diagnose using ultrasound is ovarian cyst or cystic ovarian disease. And here I'm showing you the examples of the various types of ovarian cysts that you may come across, or that you may encounter. So the previous one, I showed you the follicular cysts over here. It can be polycystic, it can be a single follicular cyst. And the other type is a luteal cyst, and you can see here the difference is that they have got a thick surrounding wall, which is hyperechogenic. And centrally, you have got this kind of trabeculus, which appears to be hyperechogenic striations, and of course, largely appearing as a dark anechoic space. And this is typically a luteal cyst. This is also another follicular cyst, a suspected one, examined and found in one of the cows. Another type of the reproductive disorder that you can easily diagnose using ultrasound also is a pyometra. So when you have accumulation of pus within the uterus, if you do just rectal palpation, you may get confused, as it may appear like a normal pregnancy because it has got this content. But when you do ultrasound examination, then you will be able to differentiate it from a normal pregnancy, because this enlargement of the uterus, having pus within the uterus, will appear uniformly having a hyperechoic kind of echogenicity appearance, or sometimes they call it a snowy kind of appearance. All right, but this is not the case when you have a pregnant uterus, right? You will have a very mixed kind of echogenicity because of the presence of fetus, placentomes, and also because of the presence of the amniotic fluid. So that appearance is not going to be there. So that is how you can easily differentiate between a pregnant uterus from that of pyometra condition, all right? So in this differential diagnosis, ultrasound will play a very important role, all right? Okay, so that's all for this session, and this is a reference for you uh, for additional and extra information purpose. Thank you.